Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, hair problem was associated with middle age when you used to lose hair or have thinning of hair and bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided and can be fixed by managing to modify our faulty lifestyle. Today, we have with us Dr. Neena Kurian, is a well-known doctor and dermatologist, has been practicing medicine for over many years now. She's MBBS, MD, DNB, DVL, dermatologist, and cosmetology. She is currently working at Medical Trust Hospital, Kuzhuppilly, and Kavungal Skin Clinic, Aluva. Dr. Neena has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized healthcare services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Neena is aware of the need for the patient awareness and education and hence spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Neena, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Yeah, thank you for inviting me. I thank IPCA and Jinesh for inviting me for this talk.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया सो डॉक्टर today we are going to discuss the causes of hair fall and the role of vitamins and mineral in hair care. So whenever we talk about hair fall, the first more question which come up to our mind is hair fall normal or not?
Hair fall is completely normal because there's a hair cycle that takes place on our scalp, and because of this hair cycle there will be some amount of hair fall which will normally happen for everybody, but it becomes problematic or you have to go see a dermatologist only if the count, like if you have more than 100 hair falls per day, the 100 strands, like when you count the number of hair that you lose while taking bath, while sleeping, while combing your hair, if the total hair is more than 100, or the type of hair, like if you're losing the growing hair, like the anagen hair, that is when you have to consult a dermatologist and find out the cause for hair fall.
Okay, doctor. So like, how can we know that what's normal and when to be concerned for like the alarm sign when we need to visit the doctor?
Okay, so first thing is there's a normal hair cycle. So there's a anagen, catagen, telogen. There's three phases through which the hair grows. Anagen is the growing phase, and that determines the final length of the hair. So around 90% of the hair on the scalp is always in the growing phase, and that is around for like 2 to 7 years, it will be in that phase. Then it goes into a transition and goes into the telogen phase. Telogen is the shedding hair. So once the hair gets converted to the telogen phase, it stays in that phase for around 3 months, following which the hair sheds and new hair will come. Again, anagen starts growing. So when this hair cycle is affected, you will have hair fall. So it could be a lot of telogen hair that is falling. So it could be because of stress. When you have stress, this conversion from anagen to telogen takes place faster. So because of which you'll have hair fall. Then it could be when you have any kind of post-COVID. After COVID, there was a lot of hair fall, or any kind of fever like typhoid, malaria, tuberculosis. Because of all this, this transition from anagen to telogen takes place faster. Then it can be postpartum. After pregnancy, you can have a humongous amount of hair fall, but that is quite normal. 3-4 months after delivery, you'll have hair fall. So you have to go see a doctor if you feel that the number of hair is more, or if you feel that there's a lot of thinning and your scalp is visible, if your ponytail is becoming thinner. So these are the things that people have to be concerned about and have to go and seek an opinion of a dermatologist.
Okay, doctor. So like you said, stress and post-COVID are some of the reasons for the hair fall. So can you enlighten us a little more today that what are the causes of hair fall?
Causes. Okay, so there's one cause, like most important is what we see is the male and female pattern of hair loss. So that is more genetic. Like in males, there will be recession of this frontal hairline. This area, the vertex area, becomes bald. In females, if you partition your hair to two sides, this area becomes a lot more widened. You can see the scalp more visible. So that kind of hair fall is more of a genetic pattern. It's more hormonal. Then there are hair falls which can be because of stress. That's one cause. Then very important cause is nutritional hair fall. So nutritional hair fall is something that everyone keeps avoiding. Like people think that not eating the amount of food and the nutrients, if you don't get, there's a lot of impact that can cause on your hair. So nutritional hair fall is very important. Stress, then fever. Then even if you have internal causes like any liver problems, kidney problems, these are problems that can cause hair fall, and that is one way of diagnosing your internal issues. Then anemia is very important cause of hair fall. Then there are other kinds of hair fall, like it won't be hair fall like in strands, but there will be patches of hair loss like in circles. That's a different kind of disease. That's an autoimmune disease. So the most common ones are nutritional and genetic pattern. There's hormonal hair loss and all these stress, fever. And one important thing is crash dieting. Dieting and reducing a lot of food intake can in turn lead to hair loss.
Okay, doctor. So, doctor, now that we know that why hair fall happens and what are the causes, the another thing is that, doctor, like nowadays we all have a poor lifestyle, like working late hours and eating anything which we can easily manage to get and eat. So, can you enlighten us, like how, like, can a person lifestyle also play a role in hair fall?
Yeah, because see, food is very important for the hair to grow. So this hair is main important thing that we get from food is proteins. Proteins are the structure that makes up the hair. So any kind of protein deficiency will lead to a lot of hair fall. So eating a lot of junk food and not including proteins in your diet. Proteins we get from all these pulses, sprouts, eggs, milk. These are very important. Then secondly, including a lot of iron containing food in your diet, like green leafy vegetables, spinach. These are things that people avoid once they eat fast food and junk food and stuff like that. Then drinking a lot of water, 3 liters per day. Then omega-3 fatty acids, eating fish. So these are things that are tend to be avoided if you eat a lot of outside junk food, because of which it can lead to hair fall in the end.
Okay, doctor. So, doctor, now that so many things have been clear for us, can you also let us know that what are the medical treatment options available for hair fall, like topical, non-topical, or like oral or surgical? What would be the best way to go for a hair treatment?
So hair fall, the treatment for hair fall always depends on the cause. It's very important to find the cause of hair fall and then treat the hair fall accordingly. So first and foremost, if anyone thinks that they have some amount of hair fall that is too much and it cannot be controlled, always meet a dermatologist, get their advice. There are few blood tests that we do normally, like to see if there's any deficiency, like vitamin D, any thyroid abnormalities, the hemoglobin, iron content. All this we run a blood test. Following which, the first thing is always treat the root cause and then add on supplements. So after you find out the cause, if there's no visible cause, you can start treatment with just giving supplements. So hair supplements can be these tablets which contain biotin, vitamin, zinc. There are these multivitamin hair tablets which are available, which are very good for hair fall. So that has to be taken for a short duration of time. Along with which there are topical treatments that are available, like minoxidil hair serums. So minoxidil stimulates the hair growth, and that is moreover given in male and female pattern hair loss. When there's an initial balding itself, you start them on minoxidil supplements. Then there's a combination like minoxidil with finasteride. It's available in the serum form as well as finasteride tablets are given. So that has to be taken only after consultation with the dermatologist, after ruling out any other health issues. So other than that, the treatments that are available are like these PRP treatments, GFC treatments are the new modalities of treatment that we do for hair fall. So PRP means platelet-rich plasma, where we take the patient's own blood, we centrifuge it, and we get the platelet-rich layer, which contains a lot of growth factors. So that is injected onto the patient's scalp. And this has to be done in a monthly basis, like every month it has to be done. And this stimulates the hair growth. The number as well as the hair that grows will be stronger, thicker, and more amount of hair will grow. A modification of this is GFC treatment, growth factor centrifuge. So it's the same procedure, just that the tubes that are collected will be specialized. So there'll be more growth factors which are released when we keep the blood, and that is injected into the scalp. So other than that, the another treatment option will be hair transplantation. But that's kind of the treatment that is done when there is visible baldness. We take the hair from the back region and we transplant it to the front region. So that is another treatment that is done. So main thing is to always identify the cause of hair fall and to treat accordingly, because without knowing the cause, just by taking treatments, it won't work. Only if we identify the cause. Like there are so many patients who come, and once we do a blood test, we find out that most of them are anemic. Their HB will be 8, 9. So it's very important to put them on iron supplements and to find out if there's any other cause for anemia as well, and then start treatment for hair fall.
Okay, doctor, very informative. So, doctor, that means there are a lot of options are available, and we should take treatment after visiting to the doctor.
Yeah.
So, doctor, there is one word called nutraceutical nowadays getting a lot of focus. So, can you also enlighten us what is nutraceuticals and what is the role of nutraceutical in hair management?
Nutraceuticals are basically tablets that contain nutrients. It can be plant derived, or it can be like zinc, biotin, tablets that contain this. So basically, these are given for hair fall. It helps in stimulating the hair growth. If there's any kind of deficiency, that will be corrected by taking these nutraceutical tablets, which are available in the market. But it's always important to identify the cause and then start on these tablets. So it has been, studies have shown that it's beneficial for hair fall.
Okay, so doctor, can we take these tablets? Like there are so many tablets on internet. So
Yeah.
can we take these by ourselves, or is it required to take this nutrient as per gender RDA requirement?
Yeah, there are a lot of tablets which are available. Like so many supplements are available online, but it's always better to check the RDA, check the label to see what are the vitamins, what are the minerals that are there in the tablets, and then take it. So it's always better to consult a dermatologist first, because they'll be more sure of what is required. Because just giving random vitamins and minerals won't help. There will be specific things that are lacking in you. So we will have to find what that is and then start the tablets accordingly.
Okay, so doctor, there are a lot of confusion. We need to clear it out. Like, what are some of the vitamins used in the management of hair loss, or we can say alopecia? There are so many, but what are the important ones?
So the first and foremost will be biotin, which is vitamin B. So that is very much important for her to prevent and to reduce the amount of hair fall. Then it has been shown that if you have deficiency in vitamin D, that will cause hair fall. So taking vitamin D supplements, at least checking your vitamin D levels once a year, and taking these weekly supplements helps a lot. Then vitamin will be vitamin biotin, vitamin D, then minerals like zinc, selenium, iron. These are the few vitamins and minerals which are very important for to prevent and to reduce hair fall.
Okay, doctor. Doctor, earlier also you mentioned that stress can cause hair fall. So can you little enlighten us more about the impact of stress on hair health?
Yeah. So, like I said, what happens in stress is when you're going through a stressful period, like it could be emotional stress, mental stress, or even through a stressful period, like when you have fever or during delivery. All these are stress. Emotional stress itself, what happens is the growing phase, that is the anagen hair, which has to be there on the scalp for around 2 to 7 years. It gets it gets converted to the telogen phase at a faster rate. Instead of like slowly getting converted over years, it gets converted to telogen phase. And once the hair gets converted to telogen, there's no going back. Like once the hair is in telogen phase, it will remain in telogen phase for 3 months and that will be shed. So because this conversion takes place at a faster rate when you are going through stress, At that moment when you're stressful, there won't be any kind of hair fall. And once 3 months later, like they'll be like some kind of family trauma happened or some kind of major accident happened. At that point of time, there won't be amount any hair fall. But they'll realize this hair fall starts only 3 or 4 months later, because the telogen hair will be there on the scalp for 3 to 4 months, and after that the hair starts falling. So most of the people, they won't attribute this to the stress that was there previously, but that was the main cause of hair fall now. So stress is very important, and it won't show at that point of time. It will just show few months later. And this kind of hair fall is something that you need not be worried about, because once the telogen hair falls, there will be growth again. So this kind of hair fall will come back. There's nothing to be worried about.
Okay, doctor, very interesting. So, doctor, like when we are at home and we are at stressful situation, our mothers always, give us suggestion that oil our hair, and putting more oil into the hair will have a long hair and a healthy hair.
Okay.
So, can you enlighten us what's the like oiling hair is boon or a ban? Can it
Uh,
really grow the hair?
So oiling as such, oiling is a very Indian tradition. It's an Indian part of the Indian custom. So we cannot say complete no to oiling, because it's part of everyone's lifestyle. But as such, oiling does not help in hair growth. Oiling will have physical help. Like when you oil your scalp, you feel a bit cool. It'll give a lot of mild cool sensation on your scalp. It clears out the dirt. It helps in all that, but oiling as such won't help for hair growth. It's more of hair serums and tablets that will help. And moreover, it's not good to oil your hair and leave it overnight, like oil it before going to sleep and then take bath early in the morning, because there's an organism that like Malassezia, which is there in everyone's scalp. So this organism grows in an oily medium, and once it grows in number, it will start producing dandruff. So initially, when you're oiling your scalp, you won't realize it, but later down the lane, it will grows in huge amounts that you'll have a lot of dandruff on your scalp. So oiling as such, it's always a full no for overnight oiling the hair, but you can oil your hair like 5 minutes before bath and then wash it off with the shampoo and conditioner. That is okay, but not oiling the hair is better.
Okay, doctor. So, doctor, can you give us some important tips for healthy hair?
Healthy hair tips will be first foremost always nutrition. Check your diet. Always include proteins and iron. Drink a lot of water. And then healthy hair will be not tying a tight pony, because if you tie, especially girls who tie a tight pony, they'll lose hair from this front area. Then always get your thyroid levels, vitamin D levels, iron checked routinely at least once a year. Then healthy hair, it's better to condition and shampoo your hair. Shampooing, you can apply the shampoo on your scalp. It cleans the oil, it cleans the dirt from your scalp. Whereas conditioner, you apply it on the hair strands. So what conditioner does is it adds moisture to your hair. So because of which that dryness, the frizziness goes away, and it gives a more of a shine and a healthy texture. Yeah, that's it. And it's better to always see a doctor if you have hair fall. Up to 100 is always normal.
Mhm.
But if you have a lot of visible scalp shown, still, if you have less than 100 hair per day, it's always better to see a dermatologist.
Okay. Like whole body hair is also important to have a regular checkup.
Yeah.
Doctor, like we have talked about vitamins. So, can you also let us know that minerals are also important for hair growth?
Yeah.
What are those minerals like? Can you
Minerals which
let us
are, it's the same thing, like zinc is important. Zinc helps in strengthening the hair. Then another mineral that is important is selenium. Selenium, these antioxidants are very important. Then copper, then iron. These are the minerals which are very important for hair growth. So these are the ones that makes up the hair strands. So if your minerals or vitamins are deficient, your hair becomes weaker. So it breaks off faster.
Okay.
So you need to have to make sure to include these vitamins and minerals in your diet to have a stronger and a thicker hair.
Okay. So, like after all these questions and so informative answers, doctor, we also want to know that whom to consult for the hair problems. Where should we go? Which doctor should we consult?
It's always better to consult a dermatologist. Always check their degrees. It could be an MD or a DNB dermatology or a diploma in dermatology. These are the people who can give you the right answers for your hair fall. Then, if anyone is watching from Kerala in Aluva, I'm available here in Kavungal Clinic. You can always come and consult me here. And always see the right doctor and start the right treatment instead of buying tablets online and trying it out and then realizing that it's not working and then going. It's always better to initially itself to just consult a dermatologist and get an opinion and then start on tablets and serums.
Okay, doctor. Like you said, there are many tablets available online. So, can you let us know that number of products are nowadays available on online and they promise hair growth? So, are they really useful?
It depends. It depends on the content. If it has biotin, zinc, iron in the correct amount, in the required RDA amount, then it will be beneficial. And hair gummies and all have a lot of sugar in it also. So I don't think it's very worth taking hair gummies, but it's better to take it in tablet form. So if it has these nutrients and minerals which I have mentioned in the correct RDA amount, it will work wonders for your hair.
Okay, doctor. This discussion was very informative. I'm sure our viewers would be benefited by it. So, doctor, can we take some live questions from our audience?
Yeah. Yeah, sure.
Okay, the first question from our audience is, Doctor, my daughter is 15 years old and I noticed her gray hair and she also go to school. Is this any medical condition or I just dye her hair? Please suggest.
Yeah, graying of hair at such a early age is a medical condition. It's called premature canities. So you will have to consult a dermatologist because there are causes to rule out. You should always get a hemoglobin checked, her thyroid levels checked, her vitamin checked. And if all these are normal, there are tablets which are there. Like there is vitamin B6, calcium pantothenate tablets, which are given for this premature graying of hair, and it will help in getting the color back. So instead of dyeing the hair at this young age itself, it's always better to first just go to a doctor, get her consulted. There'll be few blood tests that they will do, and if everything is normal, first we have to make sure that her thyroid levels, HB and all are normal. If it's normal, they will start her on these tablets. It will be a vitamin deficiency, so start her on these tablets and it will come back to normal.
Okay, so these premature hair can be controlled.
Yeah.
Okay. Another question is very interesting, doctor. Everyone wants to know. Can hair spa really grow the hair, doctor?
Hair spa doesn't help in growing. It helps in cleaning the hair. So when you get a spa done, it's basically cleansing your hair. It will cleanse your hair. So you'll feel better, but it does not help in growing the hair because there's nothing injected into your scalp or anything like that. It's just a massage and like it cleans, it shampoos the hair. So it removes all the excess oil, it removes the dirt from your scalp, and it will give a smooth, shiny texture to your hair. But growth as such, I don't think you can see after one session of hair spa.
Okay. Okay. So, like, if we expect that hair spa can grow our hair, it's a myth.
Yeah.
Yeah. Okay, that is one interesting question. Doctor, I want to have a long hair like you and clean skin like you. So, what should I do?
Okay, I think it's long hair. Just main thing is your diet. Focus on your diet, focus on your nutrition, because diet helps in clearing out the skin as well as growing your hair. Then, if you have acne prone skin, then it's better to always avoid oily fried food, reduce the oil intake, and acne prone food has to be avoided. So, which can be like whey proteins and a lot of maida like parota, pasta, all that, and sugary items, bakery items, ice creams, chocolates. These are things which can cause flare up or aggravation of acne. So these things can be avoided. Along with that, to get a clear skin, just Always use a sunscreen. Sunscreen is a must. Never skip your sunscreens in the morning. Use a moisturizer, anything which is suitable for your face. Just try, if you can't see a dermatologist, try out few moisturizers, and whichever you feel is better, continue using a moisturizer. Always use your sunscreen. Minimum SPF should be 30, and try applying it every 3 hours, because whichever sunscreen you use, most of it lasts only for 3 to 4 hours. And mainly it's a sunscreen and a moisturizer. That would do for now.
Okay. Okay, doctor. Another question is, doctor, I'm female and my age is 35, and I have androgenic alopecia. Do I need to take vitamins and minerals for my whole life?
So androgenetic alopecia means like a genetic and a hormonal hair loss. So it's better to first see it, because we need to quantify the amount of hair that you're losing. So if you have a lot of visible scalp, just by taking vitamins and by applying serum, it won't help much. If your scalp is very much visible and there's a lot of thinning of hair, it's always better to get a few procedures also done along with it. Like you can get PRP done, you can get GFC done. There's also micro needling that we do. It's an instrument with which we run it through the scalp such that it stimulates the hair growth and it infuses more platelet rich plasma into the scalp. So that's called micro needling. So these are procedures that can be done if you have a lot of scalp visible. But if it is just hair fall, you can take these supplements for a few months and see how you respond to it. And always rule out any confounding factors, like if there's any vitamin deficiency, thyroid levels. Get all this checked so that you're not missing out on treating anything.
Okay, doctor, because we are running out of time, I quickly takes the last question from our audience. Doctor, is heat treatment is okay for hair, because I want straight hair? Can I go for it?
No, heating the hair is very bad. Actually, using any hair irons, hair curls, and even a blow dryer, it dries out the hair and it makes it more frizzy in the long run. So any kind of styling procedures is pretty much not good for your hair, especially permanent straightening. All this leads to hair loss in the long run. So you can do it, but if you're using any heating devices on your hair, like a hair iron or a curler or any blow dryer, always apply a heat protectant. So there are heat protectants which are available in the market. So that will form a coating on your hair and it will protect your hair so that the heat does not directly reach your hair. So always apply a heat protectant, which you can buy online or it's available anywhere. Apply that and then only use a hair iron or a curler.
Okay. The same person is asking, can I use hair serum for the heat treatment?
Hair serum, as in, I think maybe she's referring to the heat protecting serum. If it's a heat protector, you can apply it.
Okay. Basically, we need hair protector for
Yeah,
the heat treatment, not normal hair serum and all.
Yeah.
Okay, doctor. So, doctor, finally, would you like to give a take-home message or any other suggestion to our viewers today?
So, yeah, that's it. Always, if you have any kind of hair fall, always get a consultation done. Check your nutrients, check your blood levels for all vitamins, and make sure to start the right amount of treatment with the right doctor. And there's nothing to worry about hair fall. There, everybody goes through this phase of hair fall and it will come back. So don't stress about it, because if you stress, there's more hair fall and then it becomes a vicious cycle. So just get a consult done and it'll all become fine.
And what about, doctor? Can we self prescribe ourselves, like taking Instagram and Google as a prescription?
No, it's better to always consult a doctor first, because the advice that is given on Insta and FB is for the general public. It's just for everyone together, but everyone's problem is very specific. So you need to figure out what your problem is and address that instead of just taking something that everyone's taking.
Okay, doctor. Thank you so much, doctor, for sharing so much of information and all your expertise with us today and answering all the questions for our viewers. I'm sure our viewers have found this session very helpful. And thank you, doctor. It was a delight to have you, and thank you for your valuable time.
Thank you so much. It was good talking to you also.
Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your host, signing off for today. Thank you, Doctor. Bye bye.